Okay, welcome everyone. This is the second question and answer session for the Winnebago County Mental Health Board program year 2022 to 2023 grant grant cycle. Notice of funding opportunity has been released and the grant is currently open. So we're answering questions about that today. I will briefly share a few slides. I'm not going to go through the whole presentation. There are multiple presentations on the YouTube page that have described in more detail the strategic plan, priorities, target populations, intended outcomes, grant application itself, instructions on how to register, fill out the grant, etc. We also are able to answer questions in addition to through today's question and answer session on the mental health email address, which I will share with you in just a second. So let me pull up my screen. Okay. So this is the application for the program year 2022 to 2023 grants. That program year is from June 1st of 2022 to May 31st of 2023, or the last day in May. I can't remember if there's 30 or 31 days that month. Here's the grant timeline. So the grant already opened, as you can see, on December 1st. The application opened. There was a pre-recorded grant seekers meeting that was added to the YouTube page, and you can go back and watch that at any point in time throughout this process to get more instructions about how to register, get on the grant application, what the different components of the grant application are. We had a question and answer session on December 9th. That was recorded and actually live streamed on YouTube as this one is being, so you can go on the YouTube page and also watch any questions from that. And we will also be adding a printed document to the website that will summarize all of the answers that were given for questions asked not only in the first session, but also in today's session. The application closes January 31st at 5 o'clock Central Time. That is a hard deadline. That is a Monday. Certainly encourage you, if possible, to complete it in advance of the hard deadline there, so you're not dealing with technical issues or anything at the last minute. We will be available that day here to provide technical assistance and help work through issues, but definitely don't wait till the last minute if you're able to submit sooner than that. There will be then a board review process, and board decisions are anticipated to be made and voted on April 6th. Those board decisions are contingent on work plans, any budget updates, and funding agreements being executed. So that process then will begin after those board and decisions are made, and then program year actually starts, as I mentioned, June 1st. And here's my clarification. There are 30 days in May, so the program year runs through May 30th. Just to show you just briefly the scoring categories. And again, there's more details on this in past presentations. I'm not going to spend a lot of time on it, but you can certainly ask questions about it. There's components of your agency, your overall organizational capacity, the program itself. What is the vision for the program? Who are you going to serve? Is it evidence-based, best practice, promising practice? The new category this year, although it might have been somewhat implied in last year's rubric, just clarifying and making it a little bit more elevated this year as its own category, is the community support system, which is really about how does your program fit into a coordinated system of care. Not just how does it exist independently, how does it coordinate with other providers, how does it fit within a system, is there actual collaboration in your application, or if there's not a collaborating agency, how are referrals made and things of that nature to position it well within a coordinated system of care, which is really the ultimate goal of this funding, is to establish that. And then proposal budget, kind of a basic category, but just really making sure that those costs seem appropriate for the program description and that there's nothing outside of the board's funding policy. And then only for those that are doing renewal applications, there will also be an agency continued funding category in which we're looking at compliance history, were performance reports completed on time, were budgets submitted appropriately, was there attendance at the Learning Network collaborative meetings, was there continued alignment with the priorities, did the programs keep fidelity and adherence to what they proposed to do, et cetera. There was a question from the last meeting that I was not able to answer. I wanted to get the official documentation of this. So the question was about indirect cost and specifically for de minimis, what line items could be in the budget for direct expense could be used to calculate the 10% for de minimis. So here is the actual the funding policy items as it relates to indirect. So you'll see unallowable costs would be excessive administrative cost, and then in that would be included indirect administrative costs that would be in excess of the actual program budget. So your indirect portion of your budget cannot exceed your actual direct portion of your budget. I don't anticipate that would ever happen if you're using a indirect rate. So, but just to be aware of that. And then also any indirect administrative costs that exceed those approved in the budget. So basically whatever the rate is in the budget, that's going to be the rate you're held to when you actually implement your program. And then here's the kind of the maybe more important line is any indirect administrative costs in excess of an approved state or federal indirect rate or the de minimis 10%. Ignore the lobbying costs. That's just an additional item there as part of that statement. But in terms of the indirect rate, so de minimis 10% basically means you don't have an approved state or federal indirect rate. And so you're just electing to take 10% on your direct budget. If you have an approved state or federal indirect rate, then you could take a higher amount based on what that agreement is. And generally speaking, those agreements dictate the terms of what's allowable and what's not allowable. So we expect fidelity and adherence to that. On the de minimis 10%, there is no specific limitation on what line items that you can take the 10% on. So basically 10% of the direct program budget would be acceptable. In general, if there were specific concerns for some particular reason, those could be addressed as noted in that post-award period of time where there can be execution of contracts and in some cases budget changes requested from the board to the program. So I'm going to stop the presentation there and now we'll get into the questions, and you're welcome to type those in the chat, or you can just unmute your microphone and you can ask in real time. It seems like our instructions must be really good in the application, or maybe not everyone has started their application yet. Anything?
So Jason, for those agencies that anticipate doing a renewal application or just a renewal from last year, will that be just in the portal? There'll be just like a button to push, or what do you anticipate that might look like?
Kristen, do you want to describe that?
Yeah, so the renewal applications do let you copy like a lot of the information from last year's application, but there is, because we sort of expect this to be a learning opportunity as well for your organizations, there are several questions that we're hoping you'll answer to sort of give context to what this next year is going to look like based off of what you learned from the previous year. And also so that both continued funding applications and new applications get the same like rigorous overview, and they're like compared to the same standards. So because we updated the rubric, there's some questions that are updated as well. So the application should be a lot shorter than last year since a lot of the information can come over, but there is some new stuff to answer on those. And that is in the Founded portal in the same place as last year. So if you open your old employer dashboard and hit apply, the apply button has both applications.
So you just choose which one you want to select, new
Yep.
or renewal.
And a heads up, the copy feature, while very useful, you have to copy your application into the new application in the same account that you created the old application in. So whoever owns the old application has to copy the answers into the new application. Just a heads up on that. And I want to offer, since I see some new names, if there are questions about Founded, it's a useful tool, but it is a little bit finicky. So if there's questions, anything about that, feel free to ask that here as well.
Thank you, Kristen. That was helpful.
Hey, Jason, this is John from the city of Rockford.
Hey, John.
Hey, so sure you're aware of what we're
Observation.
getting ready to do.
Ooh.
The question that I have is if we are intending to expand the program, the program that we're running with the 21-22 budget is going very well, I think, from all aspects. The program that we're intending to run in 2022-23 is what we initially applied for in the 21. Would resubmitting apologize for the noise, would resubmitting the 21 budget be appropriate, considering that half of our application got not denied, but not approved? Or would it be better for us to submit a whole new application?
It would be better for you to do two applications. One
Okay.
for the one new program application for the additional components that were not funded in the first year, and then one renewal application for the components that were funded. What will happen is that if you are in a situation where you have a renewal application and a new application and they're both approved, we will allow for those to be merged into one single work plan and funding agreement so that the administrative part of it on the back end is both easier for your organization and for us. So we want to make sure that it goes through, as Kristen was saying, that something that wasn't funded last year can't now just be tacked on to a renewal. It needs to go through the same rigorous review process that all other new applications go through. But we don't want to create unnecessary administrative things where now you're completing two budgets and two performance reports for something that could be consolidated. So we will allow for those consolidation of contracts on the back end.
Perfect, thank you.
If deemed appropriate by both parties. Certainly if there's some reason to keep them separate, we could do that. It would just, if we can reduce administrative functions of both organizations, that's, I think, generally agreeable for both parties.
Thank you.
Anything else today? Anyone that's just getting started have any questions? Has everybody been able to get into the portal? Is everybody finding the strategic plan to make sense? Do you understand how target populations are defined? Do you have screening processes in place to properly identify target populations? Any questions about that? That was kind of, I would say, if there was one consistent special condition across the board last year, was definitely with making sure there's a good screening process in place to properly identify target populations and ensure that your programming is focused on target populations. So if you haven't thought about that yet, you might want to really consider that and take a look at the strategic plan and what those target populations are and what those definitions are around that. Yes, and Kristen just linked the webpage. I would definitely encourage you to look at everything on the funding resource page specifically. That entire page has been designed to provide every important piece of information for this application. Lori, it looked like you might have been ready to ask a question.
Yeah, hi, Jason. Thank you very much for doing this. I just have a quick question about the collaborations and the partnerships as far as showing their participation or their support. It doesn't say whether or not it requires letters of support or MOUs or how much, I don't want to say proof, but we have a number of different partners that will be, and I appreciate the community support system piece that you explained, that that we will be integrating with in our request. And so just want to know how you would prefer to see that in the application.
I think the biggest thing is if you're going to be doing something that requires permission from another partner, have that written up front. We don't want this application process to be used as political leverage to strong arm another organization, right? So if you're saying we're going to go to X location and provide service direct on site, have an agreement or an MOU, or at the very least, a letter of support from that organization that says, yes, we are on board with this. We're giving permission for that. We've had several organizations that had MOUs developed post-award just because, once you find out what the specific scope is, the funding agreement, especially if you're a lead organization that's issuing subawards, you probably want to know what your contract says first. So I think MOUs are not probably necessary because you might want to know what those contract terms are first, but certainly letters of support just saying, yes, we are on board. Yes, we are in agreement with the vision. Yes, we are committed to providing X resource, or we are committed to sharing location services at Y location. I think that's the important thing, just making sure that it's that would be the biggest thing the board was cautious about last time. We don't want this to be if you're saying you're going to go somewhere and do it and you don't have the agreement, that to us is not to the board was not very certain,
And is the community support system then the place to upload those letters of support?
Kristen, can you answer that?
Yeah, so in the new application in section 5, I don't know if you have the application fail here. I'll link the PDF in 1 second, but in section 5, you have an opportunity to select whether or not your application is for a collaboration or not. And in testing it, I hoped that it would show up with section 5A, where you can upload each of your MOUs, each of your LOSs. And if it doesn't work appropriately, let me know. In testing, I hope it did, but things can go wrong. So I don't know if you saw that or not.
I will have to look it up.
Okay.
Thank you, though. Thank you very much. I'm not worried about not being able to find it.
Yeah, so Justin, for anyone that's watching and those that are on the call, I'm going to share an email address in the chats, info@mentalhealth.wincoil.us. You're welcome to send questions there, but really you can also, if you're asking a question that's specifically about the grant portal, you can call Kristen and you can talk to her about that. She's not going to talk to you about your program proposal specifically, but she will give you the technical information you need to navigate the system. And if you have questions about policy adherence, things that are in scope or out of scope for what the board will fund, you're welcome to contact me directly as well. And I can answer those types of questions for you according to what the board's policies dictate. The only real policy they've developed that directly, in addition to the strategic plan, which is not a policy, it's a vision and some guidelines, but the actual policy that you'll want to look at is the funding policy, which does dictate things that are out of scope for funding. So if you're concerned about anything, you have a question about hey, can this type of expense be included? That's probably your best place to go. And if you need clarification, please reach out to me. All right, any final questions? Okay, well, thank you all for attending again, and I hope this is helpful. And once again, please check out that funding resources page. I'm going to keep plugging it because it's so important to this process. Lori, did you have one final question for us? Or no? Okay, just
Oh, I was just going to say, bye and
popping
thank
back
you.
in to say goodbye. All right, thank you. Bye, everyone.
Bye.
Bye-bye now.
Thank you.